Hello, I'm going to give a patient education on my patient. She does vape, so I gave her this education to help her hopefully quit one day. So, first off, understanding what vaping is. It involves an aerosol produced by heating of a liquid into a device. Typically contains nicotine, flavors, and other chemicals. Some of the health risks that we talked about, obviously nicotine addiction, lung damage, EVALI is a vaping-related lung injury that could lead to hospitalization. Other symptoms could be chest pain, cough, nausea, increased heart rate. Some common misconceptions of vaping. People will say vaping is just water vaping. It contains, but it's false. It contains harmful substances. Flavored vapes are safe. Well, flavored chemicals can damage the lungs. People at risk are young and adolescents. They're very vulnerable to this. I've even noticed with the younger population how easy it has been for them to get vapes, and I see them vaping at a very young age. I'm guessing back in the day it was probably the same with like cigarettes, thinking that that's the cool thing to do. Pregnant women, obviously, you don't need to be smoking while you're pregnant. It can harm the fetal development. My patient actually is a victim of she was a cigarette smoker for 10 plus years. And then in the last 5 years, she has switched over to vaping, thinking that maybe that wouldn't be as harmful. So that's something that we have to educate them about. How it affects the body. Obviously, you get a nicotine addiction because you're smoking nicotine. I mean, whether it's a cigarette or a vape, it's inhaling nicotine. So you would go through nicotine withdrawals from that. You can have some kind of like brain damages where you have mood swings, impulse control issues, lung damage, inflammation and scarring of the lungs. It could impact your cognitive, trouble concentrating, irritability, because maybe you're sitting there working and all of a sudden you want to go vape instead of you concentrating on your working, or go smoke. So that can cause issues for people. Strategies to quit vaping. Just understanding that cravings can last for 15 to 20 minutes. Best thing to do is create a plan, set a date, identify triggers, choose a quitting method, use supportive tools, nicotine replacement therapy, counseling, those types of things to help you quit. Some coping tips for cravings. You want to try to delay that urge to do it. Distract yourself. Go on a walk, chew gum, deep breathing, just help reduce stress. Because I feel like most people who vape or smoke, when they're stressed, they're gonna go hit the vape or go smoke a cigarette. Staying active, exercising, and relaxation techniques. My patient actually is very active. She does exercise. So I think I think it's just more of a habit for her. I don't think, I'm sure when she's stressed too, that also. So just some of those coping tips would be, I feel like, a little bit harder to a certain extent with her because she is really active. Getting her to maybe like meditate, chewing the gum, just doing something else with her mouth. And I also know like the motion from your hand to your mouth, or like holding it, especially with the vape, since it's a little bit different than the cigarette, but just holding it can also be a factor. So that would be the biggest thing with my patient, is getting out of that habit and getting her to distract herself in a different way than just the exercising, because she already does that and still vapes. So that would be something that would be hard, but be something that we could work on. some resources for help. 1-800-QUIT-NOW is a phone support. We could get on CDC. There's guides on how quitting to smoke. There's education. There's programs. So vaping possesses serious health risks, addictions to the lung damage. Quitting is possible with a plan, support, and healthy coping strategies. I would definitely get her to talk to the health provider, get a plan, and just really understand the damage that's happening to her lungs. And she luckily doesn't, her family history, she didn't have. Dad had like high cholesterol, takes blood pressure. Mom died of cancer. She died of breast cancer. So there's not very, like, there's no strokes or anything, but still, you know, you could always be the first one in your family and then, you know, have that history. So I would just make sure I got a clear plan and talked with the patient and came up with some coping strategies other than the exercise, and figure out a plan and set a date, and hopefully we could get her to quit the vaping. But that is my education to my patient.